ovarian cancer, we talk about coming from the ovary fallopian tube or peritoneum, and high-grade serous ovarian cancer being the most common. What we've now found is likely to actually most of them start from the end of the fallopian tube. So abnormal cells start to form in that end of the fallopian tube before they could ever be detected by imaging or changes in biomarkers, so any changes in your blood markers. So those changes start to happen, and that fallopian tube's open to the abdominal cavity. So it's not encapsulated like an ovary, it's just open. And so those cells can slough off or shed off very early. And so by the time you would have any mass that could be detected on imaging or any of those symptoms, the cells have already spread into the peritoneal cavity or the abdominal cavity. So that's why it's very difficult to detect early and why we don't have any good screening yet. Yeah, the early signs of ovarian cancer have been really difficult to kind of tease out because most people don't present with early ovarian cancer. There was one article that looked at this, and probably the most common signs of early ovarian cancer are bloating. So just feeling a sensation of bloating, and then changes in appetite. So either a decreased appetite or something we call early satiety, which is a fancy word for saying not being able to eat as much as you used to be able to eat. So getting full fast. So those are probably the most common early signs. Maybe pelvic cramping if there's a small mass growing. I would say the most common thing people and the most specific thing people feel really is that early satiety, or that feeling full fast, and the bloating. Those are the most common and the earliest signs, I think. Pelvic pain and pelvic cramping is another one. Constipation, or not having normal bowel movements, or having new urinary urgency or frequency because of the pressure that's put on the bladder. Also, weight loss can be another sign. So some people feel like their belly's really growing because you can get ascites or fluid that builds up with ovarian cancer. So feeling like your belly's growing, but the rest of you is really kind of, you're losing weight everywhere else. That's another sign of ovarian cancer that people notice. Any patient with ovaries could be at risk for ovarian cancer. And the risk for those patients is, in general, 1 in 75 patients. The increased risk would be anybody who is getting older. So the most common age is between 50 and 60, and it's really uncommon to have ovarian cancer without a genetic reason before the age of 50. Other people that are at risk would be people with a really strong family history of ovarian or breast cancer. So anybody in their family who has 2, close family members with ovarian cancer, or a strong family history of breast and ovarian cancer, could be at risk. And then there's genetic reasons that people could be at risk. The most common are BRCA1 and BRCA2 gene mutations. We hear about those a lot in breast cancer, but also puts people at high risk for ovarian cancer. There's a few other gene mutations that are less common, but just understanding your family history and talking, with your doctors about that to see if there's a genetic component that could play a role. If you have a strong family history of breast cancer or ovarian cancer, the first course of action would be to talk about that with your either primary care doctor or your general gynecologist, and then they will refer you to genetic counseling to have genetic testing done. If you are found to have a genetic mutation like a BRCA1 or BRCA2 mutation, the recommendation is, once you've completed childbearing, to undergo a risk-reducing surgery to remove your fallopian tubes and ovaries. The age differs slightly depending on the genetic mutation, but usually it's by the age of between 40 and 45 that we recommend that surgery. There are things that can reduce the risk of ovarian cancer. So being on oral contraceptive pills for more than 5 years actually reduces the risk of ovarian cancer by 50%. And so I know a lot of people are afraid of taking hormones when they're younger because of the risk of cancer, but we've seen actually a reduction in the risk of cancer. And then the other thing that can prevent ovarian cancer, we think, is removing the fallopian tubes. So if somebody has completed childbearing and has decided they want a tubal ligation for permanent sterilization, we actually recommend just having the entire fallopian tube taken out, because that is a way of preventing the cancer. We don't just do it unless you have a risk factor, but if you happen to be having surgery for something like that, then we'd have you take them out. If you have signs or symptoms of ovarian cancer, you should go and see your provider. I would say probably your gynecologist, or if you don't have a gynecologist, going to see your primary care doctor and telling them your symptoms, and tell them that you're worried about ovarian cancer based on your symptoms so they can do a workup. Something that I think is important to know is that we are coming up with new treatments all the time. And we are really trying right now, especially at the University of Colorado, we have a large lab that's really focused on finding new treatments and more effective treatments for ovarian cancer. And things are starting to change, and we're getting more targeted therapies that we hope can cure or at least give us longer term survival.